This is the sleep center at St. Mark's Hospital. It's a dedicated sleep center where patients can come to be diagnosed and treated for various sleep disorders such as sleep apnea, snoring, and narcolepsy. When you arrive at St. Mark's Hospital for your sleep study, the sleep lab is located at the Women's Pavilion. You will park in our secure parking that is monitored continually by the County Sheriff's Department. After arriving at the Women's Pavilion, you will register and then head to the sleep lab. This is the location where your technician will greet you before you are shown to your room.
The primary one is known as a polysomnogram, and it's multiple channels which include tracings of brain waves, eye movements, muscle movements in the chin, snoring, muscle movements in the chest, oxygen saturation or levels. Additionally, some of the more unusual tests can be done during the daytime. There's something called a multiple sleep latency test, which is useful in diagnosing something like idiopathic CNS hypersomnolence, drowsiness for unexplained reasons, or diagnosing a condition known as narcolepsy. Those are often done with naps and are daytime studies. After a polysomnogram is completed, additional testing may involve CPAP, which is a small mask worn over the nose or mouth to push pressure into the airways and the upper throat to hold it open during sleep. You can use another form of pressure known as BiPAP, which is delivered in a slightly different way through a same device. There's another device called assisted servoventilation that can be used for central sleep apnea. So the devices and masks and multiple interfaces between the patient and the pressure providing device are available through this particular sleep center. There are a lot of ways that a sleep lab can help. I think when a physician is faced with someone who comes into his or her office complaining of sleep problems, it encompasses a huge group of disorders that may cause troubles, from insomnia to overdrowsiness from something like narcolepsy or one of the other sleep conditions like restless leg syndrome, obstructive sleep apnea, central sleep apnea. So a specific sleep test is marked or markedly helpful in determining what might be the nature of that sleep disorder. Without knowing the cause of the problem, the drowsiness or the poorly restorative sleep, it's very difficult for a physician to tailor the proper treatments to treat sleep apnea. And that's where a diagnostic center comes in. As a patient, you're usually asked to come to the sleep lab at about 8:30 in the evening. At that point, the technician will confirm your identity and then wire you up with multiple things. There are lots of points that they put on your head. The EEG is what it is, and people see that on television. There's a microphone that goes near your chin, some additional wires that are attached near the eyes, and usually a headband is associated with it. A band across the chest, and then EKG leads. So there are a lot of wires and a bridle associated with it that get attached to a patient. Then you try to go to sleep with all those things on, and the sleep lab is designed to be as home-like or hotel-like as can be.
This is the patient bedroom with a comfortable queen-size bed and a private bathroom. We try to make your stay here at the sleep center as comfortable and as home-like as possible.
One of the nice things I think about the beds here at St. Mark's is that the patients are asked to select varying degrees of cushioning that can be placed on the bed to try to make it as close as possible to your home sleep bed or as comfortable as possible. And because of all the wires and the discomfort and the unusual nature of being wired up for a sleep test, I think it's important to try to make the environment as comfortable as possible. The monitoring goes on through the night. There's a technician here for problems or to adjust any leads as they may come off during the night.
Each patient at the sleep center is continually monitored throughout the night by a sleep technician here in the observation room. This room is just adjacent to each patient room. This is to ensure the safety and comfort of each patient as well as the integrity of the study.
You, as a patient, shouldn't expect to get results immediately. The technician won't be able to tell you, oh, you have terrible sleep apnea, expect this from. Usually there's not a lot of conversation to be had at the end of the study. The reason being there's a large volume of data collected during the study, and a stack of paper probably this thick that needs to be analyzed by sleep experts who then can provide a diagnosis of the type of sleep apnea and feedback things to your physician. And that takes on the order of 7 to 14 days to get results out of the study at the end. There are two types of sleep apnea. There's obstructive and central sleep apnea. Apnea by definition means no air movement or no breathing. So sleep apnea is no air movement that occurs during sleep. Usually it's an obstruction in the upper throat that prevents air from entering the lungs. During an apnea that's of the obstructive nature, a person's blood pressure will initially sink and then skyrocket after the apnea is relieved. Heart rate sinks and then zooms up after you relieve the apnea. The central type is where the brain will forget to send the signal to the lungs to breathe, and oxygen levels can decrease during that particular event as well. If you have sleep apnea, you're at risk for diabetes, you're at risk for heart disease, heart abnormalities, and we know that people with sleep apnea will die a lot more frequently than people who don't have sleep apnea. So as a physician who treats sleep apnea, I think it's of utmost importance to maintain good, healthy sleep habits, and then to treat sleep apnea because of all the complications that may go with it. Now, how do you know if you have sleep apnea? As a patient, one of the biggest things you'll notice is that you feel like your sleep doesn't ever satisfy you. You wake up in the mornings and you sleep 10, maybe 12 hours, and you never feel like you got fully rested. And then you tend to fall asleep when you really shouldn't. The big things are if you're trying to watch a movie, if you sit down to read the newspaper, if you read a book, then you'll fall asleep during those things, even though that activity may hold your interest. The biggest thing to recognize is drowsiness. And then if you combine drowsiness with snoring, then usually people will have sleep apnea with those two complaints. If you add a third indicator in, if you have high blood pressure, snoring, and drowsiness, you about 95 to 99% of the time have sleep apnea. So just those three simple things will be predictive of sleep apnea in a large number of people. People who successfully treat sleep apnea, doctors, and patients who have successful treatment for sleep apnea that they can tolerate well will find huge changes in their life. They'll get more energy, they'll be able to stay awake during events that they couldn't before. Some people with extremely severe sleep apnea will be literally pulled from the brink of death back to functioning lifestyles and back to normal daily function. So it's tremendously satisfying from a physician standpoint and from a patient standpoint when it works well, because it is literally a life-altering treatment.
For more information about this physician or to schedule an appointment, please call our referral line or visit notbiggerjustbetterhealth.com.